Welcome to the second week of Public Health 645. I'd like to share what we've been doing in Canvas recently and prepare you for this week's test. So I'll be sharing all of the readings that you were assigned last week, and hopefully you've gotten started on those and finished commenting on the addiction documentary and the discussion board. Number one, I'll be posting another discussion board at the beginning of every week for you to reflect on some of the new videos that are assigned for the week, and hopefully the questions get at your own interests and ways that you can develop your final paper. So let's start sharing here what you should be seeing when you're looking at the front page of Canvas. So as you can see, there are a couple of recent announcements, including a posting for a Healing Communities study webinar that's coming up, and a newsletter that's for those of you who are really interested in this topic and want to stay informed well after this class ends. Scrolling down to week one and what you should have been up to so far in the course. We'll take a peek here and see that week one did include the Nova addiction documentary, which I personally thought was pretty great. And I've read some of your comments and responded to one or two so far. You can also see the required readings for the class, at least for the first 2 to 3 weeks, posted here, including the 2 Healing Communities studies that you need to be very familiar with, and the 2 overdose reports that were issued by the state of Kentucky and the state of Ohio last year or the year before. These are the most recent reports that I was able to pull down. Some of the other things we'll talk about in this video go into optional readings or readings that you were already assigned as part of your epidemiology course. Specifically, we'll kind of dive into chapter 3 and see what was particularly important to pay attention to there, and parts that you should really reread if you're having any kind of trouble interpreting mortality rates or some of the other estimates that are published in the articles and listed in the overdose reports. So we'll look at some of the discussion board questions later on. For now, I wanted to make sure that the Public Health 525 textbook chapters were accessible here for this course, in case you didn't have it purchased for epidemiology and handy. You can just download the same chapters that you're assigned in epidemiology here. Let's get into week 2 so it's clear which readings and videos you should be focusing on this week. Week 2, we're going to review and cover the chapter 3 content, which goes back over how to compute mortality rates. And we won't spend too much time on the experimental methods chapter, but that's another chapter you can read into before or after you've read the assigned studies, because that can be helpful. See down here for week 2, I'm going to be posting this video and also referring to two additional videos that you should take the time to listen to this week. The first summarizes the ORCA menu and how that's continuing to be implemented in the state of Kentucky for ongoing funding. And the other is a really deep dive into hepatitis, HIV, and the relationship with substance use disorder. Again, we're reflecting on each of these required studies and these two overdose reports throughout really the rest of the course. So you should get really, really familiar with those, and you'll be tested on these concepts coming up at the end of the week for the first time. For this course, I'm recommending that you really carefully review Chapter 3 if you're not really very comfortable with the content in there, because we can find some of the most basic ways, and I'll just jump to that. Some of the most basic ways that epidemiologists compare diseases, compare disease frequencies by organizing them into these 2x2 tables. Here we go. Organizing them into these kinds of 2x2 tables so that data can be cross-tabulated by two exposure categories. For this course, you're thinking about exposure categories such as fentanyl exposure, yes, no, or maybe syringe sharing for injection drug use as an exposure, yes, no, and then two disease categories, one being mental health disorder, more specifically substance use disorder, is classified as a disease, and that was introduced in the NOVA video, the disease model for addiction, or thinking about addiction. Other disease categories we'll be thinking about would be hepatitis C, yes, no, and certainly death as a disease category or an endpoint in disease. Including the outermost margins, these tables are used in studies that compare proportions, prevalence, cumulative incidence. And in Chapter 3, you can kind of go through or review many different measures of comparisons, ways to calculate rate differences, like the ones you'll read in your articles. Talk a little bit more about the case study here, the 6-city study. But yeah, there's all kinds of measures of comparison reviewed here, starting with rate or risk difference, incidence rate difference, on and on. There's calculations for risk ratios, relative risk, odds ratios, all really simple formulas that you should be pretty familiar with, and at the very least know how to come back to this chapter and reference if you're trying to interpret results in an article. 2x2 tables are even used to calculate measures of diagnostic accuracy, like specificity and sensitivity, but we'll talk about that in this video. I wanted to point out here down at the bottom the section on direct standardization, because that's a particularly important piece of the overdose reports that get published by the states, and also the estimates that you'll find in the articles. In this chapter, it can help you by rereading it to understand basic concepts like crude mortality rates, age-specific and age-standardized mortality rates. When we get down here a little bit further, you can see that you find basic equations, interpretations, with practice questions at the end of Chapter 3. And I don't know if your epidemiology professor has already assigned these practice questions, but again, reviewing this entire chapter and specifically the parts that help you understand how states and research projects come up with adjusted mortality rates is basically um, a critical skill. I'm going to just scroll back up a little bit to point out that the example study in this chapter is actually a good one to start off with as well, before or after you read the healing community study um, or studies that are assigned for this week. Look for chapter, table 3.1, and then, this one, the 6 cities study that's described in chapter 3. In this example, they reported on deaths from air pollution exposure in 6 United States cities over 15 years. Here, you're only seeing 2 of the studies, or 2 of the cities that were included in that study. That's Steubenville, Ohio, and Portage, Wisconsin. I think just rereading this chapter and starting to think about mortality rates and studies that are intended to be looking at entire environmental exposures that populations such as cities, counties, other sorts of municipalities are subject to is a good way to get started, and a starting point that you should take before interpreting estimates that have been recently published in the healing communities studies. We'll move on to share and look at together the state overdose reports that are assigned for the last week and this week. But understanding how to calculate and interpret these crude and age-adjusted overdose mortality rates and intervene upon them, it's just critically important for you as a professional, public health professional anyway. So let me jump to this report. Here we go. Today, basically each state in the United States conducts its own overdose report on an annual basis. Um, and this includes the results of their ongoing evaluation of the drug overdose epidemic. And in this example from Kentucky, you can find trends in crude and age-adjusted death rates from year to year. You can find different kinds of drugs, polysubstance use recorded on death certificates, results of those sorts of analyses. You'll find demographics and other information. And both of the examples I posted, one for Ohio and one for Kentucky, you'll find tables and maps at the end. And scroll down and see. Here are some of the figures for polysubstance use and trends over time. Age-adjusted rate for unintentional drug overdose deaths for the years going all the way back to 2014. I wanted to point to is down here at the bottom, where on an annual basis, Ohio, Kentucky, and other states that were included in the healing community study, they produce these maps that include county-specific and age-adjusted mortality rates. And then when you scroll down below, you can find raw numbers of deaths by county and year, as well as the age-adjusted rates. basically every year the state of Ohio and the state of Kentucky and probably most all other states in the U.S. will publish these sorts of results um, with footnotes explaining how the data are coded. Um, let's see if we pulled up Kentucky's results. See how these reports differ. And this is the same year, but when you scroll through and take a look at this report, you'll notice that it's organized quite different. There is a smaller set of graphs and charts that you can have to refer to, but they also look at polysubstance use and trends over time across different demographics, and ultimately down at the bottom, they'll include some maps of age-adjusted death rates and the county-specific rates. And again, from state to state, this work that's done on an annual basis and the level of detail can vary. So depending on where you're working, your health department's overdose monitoring and reporting may vary. For the test, there's really no reason to memorize contents of these reports or articles for that matter, or textbook chapters. You basically need to understand how to find and interpret estimates that are contained here. These kinds of reports are used locally and nationally to understand disparities in impacts and guide spending on critical interventions. What else should we take a look at here? These critical interventions may or may not prevent the opioid epidemic from worsening in each state or county or parish that receive resources, but the Healing Communities study and the articles that you'll be reading about are certainly the largest scale and most expensive effort to intervene on these rates. You should be able to use those kinds of reports for the test to identify, for example, what are the crude and age-adjusted overdose mortality rates reported by Kentucky and Ohio in 2023? How do causes of mortality vary according to those reports in each state? And then what are the units of analysis in these and other states that were included in the Healing Communities study? So, of course, you're going to have to read the Healing Communities studies that are posted here to find those answers. So let's take a look at one of those. And this was published just last year, and it was the primary result or the primary outcomes of the healing that were published by the Healing Communities Study Consortium and the New England Journal of Medicine. We can look through the abstract and tables included in this study and the basic background paragraphs and find most of the questions that you'll see on the test. Unlike the Chapter 3 textbook example, where 6 cities and air pollution were examined in a cohort study, that study compared mortality rates amongst about 8,000 randomly selected individuals and accounted for person time exposures. So that was 6 cities and that study went on for 14 years. The Healing Community study was much shorter, and it was designed to randomly assign and expose 67 counties and municipalities to an intervention or waitlisted exposure. Exposure is known as the opioid overdose reduction continuum of care approach, or the ORCA. So that's the other article gets into the what does the ORCA stand for and what are the contents there. We'll share that in a minute. You can find, again, most of the information that you'll be tested on will be here in the abstract, but you will have to scroll down a little bit further to find more detail and results of the study, including ultimately what the findings were at this point in time. So potentially hundreds of thousands of people living in New York, Massachusetts, Ohio, and Kentucky communities were subject to the Healing Communities study. Today, it's still very unclear how many individuals were directly or indirectly exposed to this intervention or this set of interventions, and whether or not the approach worked very well. The intervention and control period lasted for less than 4 years, as opposed to the other study we're referring to. Still, according to the NIH, this was the largest and most expensive prevention intervention study in history, costing taxpayers $343 million. And if you live near Thomas More University in the county of Kenton County, or if you live across the river in Hamilton County, Ohio, you were actually a subject of this experiment. You were included in an intervention or a control county, that is. So as we scroll down, we'll see the basic 4 states that were included in the study. We'll see differences or how they were organized into intervention and control communities. And we can see that the study reports unadjusted rate of overdose deaths, as well as adjusted rates in intervention and control communities. So you should be able to look at these estimates and talk about how they differ across states and ultimately what the study concluded with its 160 or more authors attached to it. Remember, the test questions will include how were communities in the Healing Communities study defined and selected across each state, and how were they counted, and how were evidence-based strategies selected and implemented in these communities that were compared by the study design. You'll have to read the details of this study to answer questions on and you'll have to read another study that I'll show you to get the details of the intervention strategies that were supported in the ORCA. So here we go. Of course, this study was published in 2020, years before the study I just previously shared, which was the results. The study, again, was the opioid overdose reduction continuum of care approach. So it's describing evidence-based practices that were included in the Healing Communities study. So the local node investigator was lead author. Down here, you can see tables and figures include the general approach. And when you're thinking about finding answers to all the test questions, you want to understand how to find what were mortality rates and differences in mortality reported by the study authors. Also, what were the interventions that were available in control groups and intervention groups over the couple of years. And that's what this study focuses in on. Um, what was included in the ORCA for counties and municipalities to choose from. Your test will include simple questions about the design and intervention approach. And in here you can see tables include basically the populations that they were trying to target for risk reduction interventions, the locations for and settings for these interventions, and the kinds of methods and example resources that they were supporting. In the left column, you can see the basic strategies listed. And these include overdose education and naloxone distribution, medication for opioid use disorder, and I believe safer prescribing strategies. And all these sample resources are ways to implement those basic evidence-based practices. So again, read these articles mostly to understand how the information is organized, and read the textbook chapters so you're not confused at all about the definition of mortality rates and age-adjusted mortality. I wanted to get a closer look at the syllabus at this point to make sure we talk through what's required here and how the rest of the course is going to be laid out. We'll go down to the timeline. So you see, we've already gone through and posted discussion board 1, which most or some of you have given pretty good responses to, responding to the addiction video or documentary. You should have gotten pretty familiar with these readings I just shared already, and this video is in part pointing you to the textbook chapters to help you understand those. I've just about finished discussion board 2. I'm going to post that, and that relates to a couple of different things that you're going to have to learn about this week. I'll be posting videos expanding on the different reasons that particular states like Kentucky may have invested in the 3 or more evidence-based strategies. Again, medications, naloxone, distribution, overdose education, and safer prescribing with HCS funding to understand how the different kinds of epidemiological studies are designed and implemented, and to consider cost effectiveness. It's really important that you start with basic units of analysis and intervention targets and mechanisms and the measures of comparison. And again, I recommend reading chapter 3 and 7 from the EPI textbook to get real familiar with those concepts and approaches. And then when we're getting into this week's discussion board and videos, I've started with one video that is led by or entirely facilitated seminar by Dr. Grubbs. In that video on HIV, hepatitis C, and the relationship to mental health and substance use disorders, Dr. Grubbs will teach you about the early history of HIV and Hep C, their association with substance use disorder, how to express current epidemiologic trends in hepatitis C, and explain broadly the transmission, pathogenesis, treatment, and prevention of HIV, as well as Hep C. These videos and the rest of the videos in this course are fairly long and technical. They get into very specific approaches and mechanisms and subgroups of interest. So I encourage when you're watching those videos to take some notes and also to give a thoughtful response on the discussion board, and that'll really enrich the conversation that the class is having on these videos. For Friday's test, you'll find basically all the test answers in the assigned articles and the state overdose reports from 2023. The videos are largely supplemental, starting with an ORCA specific video, this video led by Dr. Grubbs, and a couple other videos that will introduce you to buprenorphine induction and medications specifically that were promoted in the Healing Communities study. Regarding the videos and test questions, there won't be many videos or many questions that are specifically tracing back to the videos, but if they are, there'll be basic questions. For example, when was Indiana's most recent HIV/AIDS outbreak, and how was it related to opioid addiction? That's covered pretty clearly by Dr. Grubb's video here on HIV, HCV, and SUD. So getting back to where we're at now and what you have posted. We have the articles and methods that we just covered in the chapters 3 and 7. We've got the new video posted on HIV, hepatitis, and SUD. You can find these videos below. I'll be posting a couple of additional videos here, including this one, and videos that dive into the basics of medication for opioid use disorder, what is naloxone, and then perhaps also prescription, safer prescribing practices. But again, these videos, though required, are largely supplemental. You'll be able to pull out test questions from the articles. And I wanted to give one last pitch for the discussion boards. I haven't finished posting this one yet, but we'll be putting in questions that refer back to the ORCA menu and the supplemental video asking which strategy or approach in the ORCA should receive additional investment, in your opinion, and why is it more critical than others? What might surprise you, if anything, in Dr. Grubb's lecture about hepatitis, HIV, and SUD. And I put a note in here because when you're thinking through and reading about these strategies and kind of beginning to critique them and how they're applied at the state level, this is the kind of thing that you should build out for your final research paper. It'll be a simple paper critiquing one of the modalities and how it's currently implemented. And if you're participating in the residency weekend, then we'll do a live practice of naloxone furnishing and administration, or fentanyl test strip administration, or something else that you prefer or select as an intervention to reduce opioid mortality rates in our communities. So I'll end it here. Moving forward, again, I'll continue to post videos that are relatively dry compared to the NOVA video, and you should comment on those each week. And if you need time or have time for a face-to-face chat, just let me know and I'll schedule something on Microsoft Teams. So have a great week, and again, reach out if you have any questions or concern. Bye.